Good morning everyone. I am Swetja Singh, Assistant Professor, School of Pharmacy, BBD University. Today I am going to give a presentation on the topic General Pharmacology and Routes of Drug Administration. General Pharmacology. Pharmacology, it is the science of drugs. It is derived from two Greek words, pharmakon and logos. Pharmakons means drug or medicines and logos means study. Pharmacology is the study of interaction of drugs with the living organism. It also includes history, source, physiochemical properties, dosage form, methods of administration, absorption, distribution, mechanism of action, biotransformation, excretion, clinical uses and adverse effect of drug. Clinical pharmacology, it evaluates the pharmacological action of drug, preferred route of administration and safe doses range in human by clinical trials. The two main divisions of pharmacology, the pharmacodynamics and pharmacokinetics. Pharmacodynamics means what the drug does to the body and pharmacokinetics means what the body does to the drugs. Drugs are chemicals that alter functions of living organisms. Drugs are generally given for the diagnosis, prevention, control or cure of diseases. Pharmacotherapeutics. Before pharmacotherapeutics, we should understand what is pharmacy. It is a science of identification, selection, preservation, standardization, compounding and dispensing of medical substances. Pharmacodynamics, the study of the biological and therapeutic effect of drug, that is what the drug does to the body. Pharmacokinetic, study of the absorption, distribution, metabolism and excretion, ADME of drugs, means what the body does to the drugs. Now come to the pharmacotherapeutics. Pharmacotherapeutics, it is the application of pharmacological information together with the knowledge of the disease for its prevention, mitigation and cure. Pharmacotherapeutics, it deals with the proper selection and use of drugs for the prevention and treatment of disease. After pharmacotherapy, we should understand what is toxicology. It is the science of poisons. Many drugs in larger doses may act as poisons. Poisons are the substances that cause harmful, dangerous or fatal symptoms in living substances. Clinical pharmacology, it is the scientific study of drug in humans. It involves pharmacokinetic and pharmacodynamic investigation in healthy volunteers and in patients. It involves evaluation of safety and efficacy of drugs. And it evaluates the pharmacological action of drugs, preferred route of administration and safe doses range in human by clinical trials. Toxicology, study of poisonous effect of drugs and other chemicals with emphasis on detection, prevention and treatment of poisoning. Drug nomenclature, chemical name, non-proprietary name and proprietary name. What is orphan drugs? These are the drugs or biological products for diagnosis, prevention and treatment of rare disease or common disease for which there is no reasonable expectations that cost developing and marketing it will be recovered from the sales of drug. For example, sodium nitrite, liposomal amphotericin B and liothrone. Orphan drugs, they are so called orphan drugs are because these are pharmaceutical agents and developed to treat certain rare medical conditions. Orphan drugs would not be profitable to produce without government assistance due to a small population of patients affected by the condition. The condition that orphan drugs are used to treat are referred to as orphan diseases. The assignment of orphan status to a disease and the drug developed to treat it is a matter of public policy that depends on the legislation of the country. According to US Food and Drug Administration (FDA), an orphan drug is defined as one intended for the treatment, prevention or diagnosis of rare disease or condition which is one that affects less than 2 lakh person in the US, which equates to approximately 6 cases per 10,000 population or meet cost recovery provision of the Act. Now comes to the routes of drug administration. A routes of drug administration is a way that a drug can enter the body. There are many drug routes of administration, each suited to different situations. Each route has its benefit and potential risk. The most common route is through the mouth. Drugs can also enter the body through the skin, gums, veins, nose, and many more. There are many different drug routes of administration. Some are commonly used while others are rare. Drug administrations can be oral, which is when a person swallows a drug, intraocular or into the eye, intra-aortic or into the air, nasal or through the nose, sublingual or under the tongue, buccal between the gums and the mouth cheek, inhaled through the respiratory system, internal, which is when a person receives the drug directly into their digestive tract, rectal through the rectum, vaginal through the vagina, transdermal through the skin, subcutaneous under the skin, intramuscular via injection into the muscles, and intravenous into the vein. There are the factors governing choice of route of administration. Physical and chemical properties of the drugs: solid, liquid, gas, solubility, stability, pH, and irritancy. Site of desired action: localized and approachable or generalized or non-approachable. Rate and extent of absorption of drug from different routes. Effect of digestive juices and first pause metabolism on the drug. Rapidity with which the response is desired, routine treatment or emergency. Accuracy of doses required, IV and inhalation can provide fine tuning. Condition of the patient: unconscious and vomiting. Local routes: these routes can only be used for localized lesions at accessible sites and for the drug whose systemic absorption from these sites is minimal or absent. Topical route: it involves external application of the drug to the surface for localized action. Drugs can be efficiently delivered to the localized lesion on skin, nasal mucosa, eyes, ear canal, anal canal in the form of lotion, ointment, cream, powder, spray, and lozenges. Deeper tissue: certain deep areas can be approached by using a syringe and needle, but the drug should be such that systemic absorption is slow, that is, intra-articular injection. Hydrocortisone acetate. Arterial supply: close intra-arterial injection is used for anti-cancer drugs. They can be infused in femoral artery to localize the effect for limb malignancies. Systemic routes: the drug administered through systemic route is intended to be absorbed into the bloodstream and distributed all over the body, including the site of action through circulation. Oral route: oral injection is the oldest and commonest mode of drug administration. It is safer, more convenient, does not need assistant, non-invasive, painless. The medicament need not to be sterile and so is cheaper. But both solid doses form powder, tablet, capsule, molded tablets, and liquid doses form syrups, emulsion, mixtures can be given orally. Limitations of oral route of administration: action of drug is slower and thus not suitable for emergencies. Unpalatable drugs, chloramphenicol, are difficult to administer, may cause nausea and vomiting. Amines cannot be used for uncooperative, unconscious, vomiting patients. Absorption of drugs may be variable. Certain drugs are not absorbed. Others are destroyed by digestive juices, penicillin G, insulin, or in liver. Sublingual or buccal route: a tablet or pellet containing the drug is placed under the tongue or crushed in the mouth and spread over the buccal mucosa. Only lipid-soluble and non-irritating drugs can be administered. Absorption is relatively rapid. Action can be produced in minutes. The chief advantage is that liver is bypassed and drug with high first pass metabolism can be absorbed directly into systemic circulation. Drugs given sublingually are getian, buprenorphine, and desminooxytocin. Inhalation: volatile liquids and gases are given by inhalation for systemic action. Absorption takes place from the vast surface of alveoli. Action is very rapid when administration is discounted. The drug diffuses back and is rapidly eliminated in expired air. Thus, controlled administration is possible with moment-to-moment adjustment. Irritant vapors cause inflammation of respiratory tract. Example, general anesthetics. The mucous membrane of the nose can readily absorbs many drugs. Digestive juices and liver are bypassed through this route. However, only certain drugs that are applied as spray or nebulized solution have been used by this route. Example, GnRH agonist, desmopressin and insulin. Parenteral, par means beyond, internal, intestinal. This refers to administration by injection, which takes the drug directly into the tissue fluid or blood without having across the intestinal mucosa. Advantage: drug action is faster, valuable in emergencies. Gastric irritation and vomiting are not provoked. Parenteral routes can be employed even in unconscious, uncooperative or vomiting patient. There are no chances of interference by food or digestive juices, and liver is also bypassed. Disadvantage: the preparation has to be sterilized and is costlier. The technique is invasive and painful. Assistance of another person is needed. There are chances of local tissue injury, and parenteral route is more risky than oral route. Subcutaneous: the drug is deposited in the subcutaneous tissue, which is richly supplied by nerves, but it is less vascular. Absorption is slower than intramuscular. Only small volumes can be injected subcutaneously. Self-injection is possible because deep penetration is not needed. In rectal route uses the rectum as a route of administration for the medication and other fluids, which are absorbed by the rectum vessels and flow into the body circulatory system, which distributed the drug to the body organs and bodily systems. Intramuscular: the drug is injected is one of the large skeletal muscle, deltoid, triceps, gluteus maximus, rectus femoris. Muscle is less richly supplied with sensory nerves. Mild irritants can be injected and is more vascular. Absorption of drug in aqueous solution is faster. It is less painful, but self-injection of impracticable because deep penetration is needed. Depot preparation: oily solutions, aqueous suspensions can be injected by this route. Intramuscular injections should be avoided in anticoagulant treated patient because it can produce local hematoma. Intradermal injection: the drug is injected into the skin, raising a bleb. Example, BCG vaccine. This route is employed for a specific purpose only. Intravenous: the drug is injected as a bolus or infused slowly over hours in one of the superficial veins. The drug reaches directly into the blood streams and effects are produced immediately. Great value in emergency. Only aqueous solution, not suspension, can be injected IV, and there are no depot preparation for this route. The dose of the drug is required is smallest, bioavailability is 100%, and even large volumes can be infused. In case response is accurately measurable and the drug is short-acting sodium nitroprusside, titration of dose with the response is possible. However, this is most risky route vital organs. Thank you.